Well, hey there, I'm Dr. Barbara Woods, and we're going to talk about the power of specialization and how, when we specialize programs and get greater training for ourselves as therapists, that we can really tailor therapy for optimal client outcomes. This is really important because it has three main benefits for our clients and ourselves as therapists. First of all, it really helps the therapy outcomes. So we get better results when we're more specialized, and it supports diversity when we have that specialization. So it is a lot better for our clients who come from diverse backgrounds and may have different needs. There's positive impacts for therapists as well, because it helps reduce burnout, it helps us feel more effective, it helps us feel like we really have a solid handle on what's happening with our clients. The bottom line is that it helps create a safe space for the client where they feel seen, understood, heard, without having to explain a lot or not having to justify what they've been through, because a lot of our clients have had to do that over their lifetimes, and they just need a safe space to come to somebody and get that support and healing. So when we have that specialization, we have that safe space, the client feels seen and heard and understood, there's greater safety and there's greater resonance between the therapist and the client. So that resonance is kind of the energy that goes between people, and it's more of a felt sense of safety in the context of a relationship. So it allows the client to be the expert of their journey. And this is really important because a lot of clients who've been impacted by intergenerational trauma, their perception or their experiences have been invalidated a lot. So it's very important that they're seen as the expert in their journey. Therapists can have an expertise, but the client's the expert in their journey, in their experience. So this is where the intergenerational trauma therapy specialization really helps build that foundation with that specific population that's dealing with complex developmental trauma within the context of a family system. So when we use kind of a one size fits all or a generalist approach, there's some pretty significant limitations. Those include that the client may not feel like we're really kind of resonating and understanding what they've gone through. They may feel like they have to explain more, or it's harder for them to get their experience across to the therapist, which can really cause some shutdown for the client. And that's where it's really important to move from generalized skills as a therapist into those more specialized skills. So, first, we're going to look at the impact of specialization on the outcomes of therapy itself. And really, it leads to better assessment and treatment planning. So, when you have an expertise in a very niche area, that allows you to really delve deeply into kind of the nuances of that area of mental health. So, you have a much greater understanding of signs, symptoms, underlying causes in that specific area. And this expertise leads to more accurate assessment, diagnosis, and tailored therapy and interventions for them based on their specific experience. You also have a lot of precision in what interventions you have available and what you select for working with a particular client. So, a specialized therapist has a well rounded understanding of interventions that work best for specific issues, populations, and therapy modalities. And we can also create a treatment plan that really zeroes in on a client's specific needs that's really suited to that person individually. There's also efficiency of resources, because as a specialist, you'll have a wider range of tools. You'll have wider questionnaires or assessment methods that are finely tuned in that area of focus. So, for instance, if you're working In general, with trauma, and you do an assessment, it's going to look at more of the impact on the individual, like if they get startled easily, if they avoid certain things, if they feel like life will never be good again. Those are specific to that individual. But when we look at intergenerational trauma, we have to consider the family and the parent child relationship so that we can help support that relationship in order to move forward and stop the transmission of intergenerational trauma. So there's a more efficient and effective method and process that we can use when we have that specialization. Another huge benefit is there's reduced misdiagnoses or misassessments and inaccurate case conceptualization. So, if we have greater understanding of the complexities and nuances of a specific area, we're more able to accurately come up with a case conceptualization and then develop a treatment plan from there. So, understanding this in a deep way helps increase the likelihood of correctly identifying the issues that may be easily overlooked by someone who doesn't have that specialty. So, with intergenerational trauma, this may be where the therapist tends to work with either the child or the parent, but doesn't look at them as a system together or doesn't know how to intervene in a way that's efficient and effective for both as they move through the therapy process. We can also adapt the treatment path or the process as we go along when we have that specialization. So we're better equipped when we're specialized to modify treatment plans as they progress. We can kind of catch on that there's an issue that may arise and we need to be aware of that, or we need to look at this next kind of secondary issues that can come along with treating intergenerational trauma. We have a more comprehensive understanding of outcomes. So it wouldn't be just down regulating or having symptom relief for an individual. For intergenerational trauma, it would be that the down regulation and symptom relief, but it would also be improved relationships with children. The children's behavior would be better, the children's symptoms would be less, and there's more harmony in the family system. So that's where we can really adapt the treatment path and have a structure, but a lot of flexibility within that. Can also identify potential roadblocks, that things that may kind of interfere with progress or engagement. And we may also have effective alternative approaches that kind of support that specialization, such as brain spotting, EMDR, hypnosis, all of those things that really help support the progress and knowing when to use those for a particular client. So now we're going to look at customizing the therapy needs for diverse clients. So when we are working with people from different backgrounds, it's really important to have a really good handle on the things that may be impacting their therapy and what we need to do as a therapist to ensure that therapy is successful and impactful in a good way and doesn't cause harm. So we need to understand the diverse cultural issues that may arise, generational issues, and also the individual factors. So, first, specialization in therapy, it's not only mastering a technique, but it's understanding the cultural context the client lives in. So that's your cultural competence. It involves acknowledging and respecting the cultural norms, their beliefs, and their values that influence mental health and those therapeutic outcomes. So we really have to understand the culture and the context of that individual's life and upbringing, their beliefs, their values, in order to use those to support them in therapy to improve outcomes. And of course, in intergenerational trauma therapy, you have to have generational sensitivity. So different generations have really unique approaches to therapy, and it's shaped by their experiences. So my generation is probably more reserved about disclosing mental health issues or struggles, where young people today, they put them right out on social media, and that's kind of their norm. To us, it probably doesn't look as healthy, but for them, that's how they express themselves. So we have to honor those differences between generations as well. And it also includes technology advances, which mainly social media, gaming, things like that, that can have a huge impact on families and on the wellness of children and teens. So we have to be able to, at some degree, modify our techniques to be generally generationally sensitive and effective. So we can't use something that only teenagers will relate to if the adults or grandparents won't be able to relate to that, because when we're working with intergenerational trauma, we have to be able to meet the needs of the entire family. An individual variation. So even within specific cultures, generational groups, each individual has their own unique things that they need, things that they have experienced, that we really have to honor those too. So we need to have that flexibility to adapt to fit an individual need, their preferences, their circumstances within the overall family system. This is why intergenerational trauma therapy is quite complex and complicated, because we're looking at all these different variables that are really important that go beyond when you have just one individual that you're working with. We also want to be able to look at intersectionality. And this is where we understand overlapping systems that create struggles, discrimination, or disadvantages for our clients. So it could be race, gender, class. There's so much that intersects and can create a lot of pressure and a lot of disadvantage for certain people. So we need to be aware of that and help understand how that comes into the therapy process, into the family system. And we really have to understand the impact on the individual and the family. Historical and collective trauma is also really important to be aware of. Certain groups of people historically have experienced significant traumas, or there's been collective traumas in communities where there's been critical incidents that have traumatized large numbers of people in the community. So we have to understand those historical events, those collective experiences that may be in a community, a group of people, within a family, that shape the mental health of those specific groups. We also want to be aware of our language and communication. We need to look at language barriers or specific communication styles. And we have to adapt our interventions to make sure that our communication is clear and effective in what the client can understand and what they relate to. So, one of the things that I've learned in working with Indigenous populations is that the communication sometimes can be more heart to heart, that there doesn't need to be a lot of words, there doesn't need to be a lot of talking and questions, which I had to really get a handle on to stop myself from doing that. So it's more of a felt sense in relationship. It's more about that resonance than it is about the words. So we need to be aware of those nuances in the populations we're working with in order to create that safe space for them in therapy. We also want to know about any kind of stigma or taboos within a person's family or culture, maybe related to anger, that we just don't express anger, or you don't cry because that would be seen as weak. It could be anything like that. It could be within the culture, it could be within the family, or it could be between generations, because they all have their own views on mental health and wellness and therapy. So we have to have strategies to navigate around these stigma or taboos that can be a barrier to treatment. We also want to consider ethical considerations where, when you're specialized, there's a deeper level of ethical understanding that's unique to working with different populations, maybe informed consent, confidentiality, autonomy to make decisions. We have to understand what a certain population or family needs and what's ethical to work with them. So, one of the things we've done in our practice is we work with a lot of people because it's more of a heart to heart felt sense. If you go in with a clipboard and a pencil and you ask a lot of questions, it's kind of off putting to the majority of people from those communities. So, we have moved the way that we do our intake so that it's consistent for most people with some strategies that are for considerations of the needs of them. So sometimes we do use pencil and paper, but with everybody, we try to start out with kind of that heart to heart and just really establish the relationship first, because that's what really heals in therapy to begin with. So, accessibility, we want to look at any socioeconomic factors that may have a role in a person's ability to engage and benefit from therapy. So, that could be the scheduling that they work long hours because they're a single parent and they can't get time off easily. So, we may have to have some flexibility there, may need to have sliding scales, may need to have the ability to do video sessions or other distance counseling, and may need to get them hooked up with community programs and outreach so that we're making it accessible to them. We also need to care about ourselves and not overextend our schedules and be working 24/7. So there's always a balance there, but we do need to watch those factors that make therapy inaccessible for some people. And one of the other things that we can do is to just do ongoing learning because it's ever evolving. The field has evolved so rapidly in the last 10 to 15 years that it you have to stay up on current research and literature. So it really takes a commitment to stay up to date on the latest researches and perspectives regarding cultural, generational, and individual diversity. Okay. So now we're going to talk about the positive impacts for therapists. So the positive impacts for therapists include an enhanced credibility and authority. Now, authority doesn't mean that we are the expert over our client or that we are imposing our will on the client. It means that you have a command of your subject area. So we never want to get that mixed up, that if we have credibility and authority or an expertise, that we are the ones that make all the decisions, because this is a collaborative process with the client's needs first and foremost. So when you build a brand around specialized skills, it does elevate your status as an expert, and it's not about ego, it's about people having confidence in your skills, because if they have confidence, they're more able to have that sense of felt safety. So it boosts your credibility. You can become a go to authority for consultations. People will start to understand that you're the person that would have the answers for this particular difficulty or problem. You may be asked to speak certain places, train certain people, do some publications, and it further builds your expertise. And we've put a lot of time and effort into our profession, so we like to build that sense of having an expertise. It can also help the therapist by increasing referrals and retention. So referrals will start to come based on your specialization. So if people know that you specialize in critical incidents, those people are going to start to be attracted and drawn to your practice. When people know that you're an expert in intergenerational trauma or have specialized in that area, they will be drawn to your practice because you can attract and retain specific clients and you can get better results. And people are looking for those unique skill sets in therapists. It also improves the therapist client relationship because of that felt sense and that resonance when we have a very highly attuned understanding of their needs. It makes marketing easier and helps make things more efficient and cost effective as well. So, professional growth and development, which, if you're anything like me, you've got tons of books, you love books, online courses. So, having a specialized brand encourages continued learning and mastery. We have to stay updated in that niche, and that helps us build momentum in our practice and helps us feel really good and solid about the services that we're providing. It also gives us opportunities for developing our own courses or workshops or other educational materials or additional things that help clients and referral sources. So there's a lot of different aspects of professional growth and development that become possible with specialization that go just beyond your own learning. It can be giving back and helping other people learn as well. So, specialization also helps reduce therapist burnout by increasing the efficiency and effectiveness and satisfaction that we have in our work. So, the increased efficacy, if we have a certain therapeutic approach that allows therapists to become specialized in that field, it increases how well our outcomes are, how the outcomes that we can get for clients and what how they feel about therapy as well. So having those higher success rates, it boosts our job satisfaction because this is a tough line of work. We're dealing with really complicated, difficult things. And if we can feel good about the outcome, then it also helps us have our longevity in this career. It can decrease imposter syndrome or feelings of inadequacy or helplessness. And those are all things that contribute to burnout. So if we're in a field where we have clients that require a specialized intervention, but we don't have that specialized intervention, we're much more likely to have burnout and not have a long career in the field because it's difficult work. Another benefit for therapists is streamlined case management. So we can have a more targeted client base, we can anticipate challenges, tailor interventions, and all of this becomes more effective. So it reduces the cognitive load and the emotional toll of being kind of a generalist. So when you're a generalist, if you're working with anxiety, depression, trauma, parenting, those are all very specific areas that we have to have sufficient skills in those areas to work with those clients. So we can be spread very, very thin if we take that generalized approach. And that causes an emotional toll on the therapist and also leads to a lot of burnout. Because our work is so difficult, it has a lot of meaning, but it's very complicated. It's important that we also have job satisfaction and create meaning out of the work that we're doing. So if we can find a deeper meaning, knowing that we're making a significant impact, it makes the difficulties or the stress in the work a lot easier to carry and manage. And if we have a sense of accomplishment or purpose, that also helps us with job satisfaction as well. It prevents burnouts, promotes greater long term career sustainability. A lot of therapists get in the field and then they kind of contemplate having gone into the wrong field and wanting to leave because it can be very heavy and it can be very difficult. So if you have that specialization, it can help reduce that load. So, with comprehensive skill development, an example of this would be the Intergenerational Trauma Program, where therapists learn to become specialists in treating intergenerational trauma. So, they learn about complex trauma in adults, developmental trauma, family systems, all of those areas that impact the family system. They also learn about autonomic regulation and co-regulation and helping support child development, building family resilience, because all of these things are what's important to shift from intergenerational trauma to intergenerational resilience. So it gives the therapist a very in-depth understanding of these complexities of intergenerational trauma. So it's highly specialized, it's effective, and it's very efficient. It's a framework that has structure, but it's also got flexibility to meet the individual needs of the client, the family, or the person that comes from a community or culture. Usually, when you have higher specialized training, there you have a much more rich resource of materials available. So you may have more resources for assessment. You may have more resources for suggestions for clients for self regulation or regulating their autonomic nervous system rather than just a few things that might kind of help, but they're not highly specialized for the client. So the intergenerational trauma toolkit is what kind of provides that bottom line foundation of effective assessment and intervention strategies. It's got tons of client handouts. Both the toolkit and the intergenerational trauma program have tons and tons of handouts for clients. There's 5 workbooks in the intergenerational trauma program. So there's a huge deal of resources available because that's what therapists need when working with complex cases. But it's also what the clients need to reinforce their learning at home and to apply those skills when they're not in the therapy room. So this helps the therapist feel much more confident and competent to handle these complex cases, and like they really know what they're doing and they have the resources in order to manage anything that would come their way. So, specialization also can elevate a therapist's professional standing, positions them as having an expertise in a niche field. For me, it's intergenerational trauma. And this is really important because it signals to people who you treat and who you can support and what areas you'll be really helpful for them in. So, that enhanced professional standing, again, it's not about ego, it's about having very highly specialized skills so you're effective and efficient in your therapy. So, that is how we can tailor interventions to get better outcomes for families in therapy when we're working with intergenerational trauma. So, these are really important for clients to feel like they're making progress to reduce our degree of burnout and to also enhance professional standing so that people know that we can handle certain cases and that we're a good match for certain referrals. So, next time we talk, we're going to talk about the future of therapy and leading with neuroscience to transform your practice. So, neuroscience is one of the most important areas for all of this and all of therapy because if we can really understand the neuroscience that is underneath the relationships, the behavior, we can really have much more effective outcomes. I do have a PDF that summarizes all this. If you would like a copy of that, just send me a message and I would be happy to send that to you. And I hope you have a beautiful day, and I will see you next week.